So with that, let's go ahead and begin our presentation. Name of our presentation, Taming the Medical Record Dragon. And so we provide, Forest Rim is who we are, along with our partner IBEX Solutions. We provide technology that either works in a standalone or cloud-based environment, collaborative text conversion and analytics for your medical records. And so to give an example of who might need something like this, according to the CDC, 85.9% of office-based physicians are using some form of an EMR system. The global EMR marketplace was valued at $24 billion. So there's a lot of people out there trying to make sense of and work with EMR records. North America accounts for the largest share of the records and so forth. So with that in mind, what are the challenges that doctors and hospitals face when they are looking at going through records? Well, number one, there's a large number of records. There's no shortage of medical records that are out there. A second problem they face is that many of these records are on different various and sundry sources. It's not like you have just one source of documents in your organization. You've got a lot of different sources. A third problem that you face is inconsistency of terminology and format, and we'll be talking about that. Then there are other issues: security, HIPAA compliance, optimized billing, risk management, and so forth. So these are the kinds of things that when you have to go get information from medical records, here's what you face. And so today, how is it done? Well, at least the people we talk to, in many cases, try to do it manually. And to do it manually, you've got to have people that are specialized in knowing what to look for and how to look for it. There are extended delays to conduct research. If you do it manually, it's going to take some time. There's no way around that. Furthermore, there are limitations on the scope. The doctor I talked with said in his career, he looked at 25 individual records researching information for his patients. And that increases all of this, the probability of an error. So what are some of the issues? Hardly all of the issues, but one of the issues is inconsistent terminology. My favorite inconsistency in terminology is medications such as furosemide. If you look up for furosemide, you will find out that furosemide goes by 80 or 90 different names. It's the same thing. It's the same medication, but some people call it Lasix, some people call it Mirfat, some people call it Lodix, some people call it furosemide, but it's the same thing. And the problem is when you have medical records from a wide variety of sources, they can well be talking about the same thing as somebody else is talking about, but the words that they are using are completely different. And so that's one problem. Another problem we have is analyzing large volumes of documents is challenging due to the inconsistency of terminology and format. One hospital will have one format and way of looking at its text. Another hospital will have another way of looking at its terminology and its formats, and they're not the same. And now a human being can read these and understand what the differences are, and I understand that. But when it comes to doing this in an automated fashion using a computer, it's not so easy for the computer to just switch formats.